So good afternoon. I'm Dr. Augur Igbuna, and currently I serve as the Clinical Development Lead for Kidney Disease Programs at Vertex Pharmaceuticals. It's an honor to be part of the 50th Annual Congressional Black Caucus Foundation's Legislative Conference and to serve on this important panel today. Before we begin, I'm honored to introduce the Chief Executive Officer and President at Vertex, Dr. Reshma Kewalramani, who will make a few introductory remarks at this time.
Good afternoon. My name is Reshma Kewalramani, and I'm the Chief Executive Officer and President at Vertex Pharmaceuticals. It is an honor to be here with all of you today, albeit virtually, at the Congressional Black Caucus Foundation's 50th Annual Legislative Conference. Vertex is a global biotechnology company headquartered in Boston. Our mission is to invest in scientific innovation to create transformative medicines for serious diseases like cystic fibrosis, beta thalassemia, sickle cell disease, and severe kidney diseases. We are a different kind of biotechnology company. We go after some of the most difficult scientific problems and always focus our efforts on addressing the root cause of disease. We believe our time and money are best spent on science rather than sales and marketing. For example, 70% of our operating expenses and 60% of our employees are dedicated to research and development. It's an important piece of who we are as a company. At the end of the day, our goal is to transform the lives of people living with serious diseases. It's a passion shared by every employee at Vertex. We often refer to patients as our true north. They're our single source of inspiration and motivation. Every decision we make and every step of the drug discovery process is with patients in mind. I'm thrilled to be able to help introduce the panel for today. It is a topic that is near to my heart, not only as the CEO of a company working relentlessly to address the unmet need of this disease, but also as a nephrologist who spent years caring for patients living with kidney disease. I've seen firsthand the toll that kidney disease can take on patients and their families, which is why I am so committed to the work we're doing at Vertex to potentially transform the way we treat certain genetically mediated kidney diseases. For instance, certain genetic mutations, such as those in the APOL1 gene, can increase the risk of aggressive and relentless progression to chronic kidney disease and may eventually lead to kidney failure, which requires dialysis or transplantation. In fact, end-stage kidney disease and earlier stages of chronic kidney disease represent one of the most striking examples of racial and ethnic disparities in health. The APOL1 genetic kidney disease variants have only been observed in individuals with African ancestry, and this link between the APOL1 gene and kidney disease was discovered only about a decade ago. At Vertex, we're using that discovery to inform our efforts to develop medicines with the potential to address the underlying cause of this disease. Today, we have an extraordinary group of panelists who know all together too well the urgent need to deliver transformative medicines to patients living with this genetic kidney disease. I imagine the conversation will be both sobering and inspiring, and that, like me, you'll come away motivated to work towards altering the course of this debilitating disease. Thank you.
Hello again. As mentioned, I'm Dr. Augur Igbuna, and I'm a trained nephrologist, and I've cared and treated for patients with kidney disease for close to 20 years. And I know that we all share our regrets that this panel could not be held in person today, but I'm grateful for the opportunity to participate virtually and to join my distinguished colleagues on the panel today to talk about this extremely important topic. I'm thrilled for the panel that we have lined up today, where we'll be highlighting the importance of finding the root cause of individual kidney disease, which to date hasn't been very successful. Studies suggest that kidney failure is unknown in 5 to 20% of patients, and a growing body of research also suggests that a subset of these unknown causes of kidney disease may actually be due to genetic variations or mutations. I'm going to speak very briefly about one of these genetic variations. You've just heard from our CEO, Reshma, about some of the important work taking place at Vertex. As she noted, one of the areas that Vertex is currently focused on is working to discover and develop medicines aimed at treating the underlying cause of APOL1-Mediated Kidney Disease. But before we get to that, let's talk about why we're here today. To the left-hand side of this slide is a graphic presentation of the number of people with kidney disease broken down by race. In this recent 2020 report by the US Kidney Data System, the red line represents an estimate of the number of people that identify as Black or African American with kidney failure. And you can easily tell that the number is higher than the estimates for all other racial groups. Another reason why the topic of kidney disease is so important is because the financial implications of progressive kidney disease and kidney failure are serious. Some people would tell you that it's catastrophic. And in the figure to the right, you can see how the cost of kidney disease rise annually as kidney disease worsens, with estimated costs over $60,000 a year for those that have achieved end-stage renal disease. Just imagine that kind of expense, be it to the individual or to the community. And to give you another sense of the magnitude of the financial impact of kidney disease, approximately 30 billion, or about 5% of the budget for the Centers for Medicare and Medicaid Services, was spent on patients with kidney disease that represents less than 1% of the population of patients covered by Medicare and Medicaid. So the impact is substantial. It's disparately impacting patients of African descent. And there's now substantial evidence that there's a genetic basis for some of the disparity in the burden of kidney disease seen in people of African ancestry. So if we go on to the next slide, I'd like to speak briefly about the APOL1 gene that evidence indicates explains a lot, but certainly not all, of the higher burden of kidney disease in people of African ancestry. The APOL1 gene is part of the APOL gene family, which plays a role in what we call innate immunity, our body's ability to fight threats such as infections or cancers. And in 2010, scientists showed that the higher rates of two severe kidney diseases in African Americans could be attributed to variants of a gene called APOL1. We all have the APOL1 gene, regardless of your racial background, and it's present in many tissues, including the kidneys. And over thousands of years, the gene evolved in specific ways in people who lived in Western and Central Africa. As you can see, if you go back to the previous slide, as you can see in the map to your left, to protect people from resistant forms of the parasite that causes African sleeping sickness. And in the figure to the right, it shows images of the parasite and the variations in the APOL1 gene that we call the G1 and G2 variants that protect against the resistant forms of the parasite. And in 2010, we found out that people with two copies of these APOL1 variants are not only at higher risk of disease, but at risk of rapidly progressive disease. As people from these regions have migrated around the world from Africa, initially as part of slave trade and later as part of modern day migration, these genetic variants in the APOL1 gene have been taken with them. And today, people of African descent may carry these APOL1 variants, including people who identify as African American, Afro-Caribbean, and Latino. On the next slide, I mentioned that there's now evidence that indicates that much of the disparity in the burden of kidney disease can be attributed to genetic variants of the APOL1 gene, which again is found in people or individuals of recent African ancestry. People with two copies of the APOL1 genetic variants have not only an increased risk of disease, but it's estimated that these genetic variants of the APOL1 gene explain about 70% of the kidney failure in African Americans with non-diabetic kidney disease, and that 4 out of every 10 African Americans with end-stage kidney disease have the APOL1 genetic mutations. On the next slide, to give you a sense of the impact of the APOL1 genetic variants, this graphic shows how people with a certain form of kidney disease called FSGS, an abbreviation for focal segmental glomerulosclerosis, progress to kidney failure over time. The orange line represents the progression of disease in people with 2 copies of the APOL1 risk variants. And this rate of progression is 2 to 3 times faster than the progression of disease in people who do not have 2 copies of the APOL1 genetic variants. The statistics are essentially alarming. Increased risk, more rapid progression of disease, and very often treatment resistant, at least to the current standard of care. We know that the impact of kidney disease on communities of color remains a major challenge, and all of which makes the attention to the causes of kidney disease and increased awareness about the disease even more important. So today's panel will share some key insights and opportunities to address the challenges for patients diagnosed with kidney disease. You'll also hear more about an important initiative to address the unknown causes of kidney disease spearheaded by the American Kidney Fund. Vertex is proud to be a supporter of this important project. So now I'd like to introduce our panelists. Dr. Silas Norman. Dr. Norman is a transplant nephrologist and the co-medical director of kidney and pancreas transplantation at the University of Michigan, and the director of the Transplant Multispecialty Ambulatory Clinic. Dr. Norman is a member of the American Kidney Fund Board of Trustees and a steering committee member of the American Kidney Fund's Unknown Causes of Kidney Disease Project and Roadmap. Today, Dr. Norman will share key insights and findings from that landmark report, which was just released a few weeks ago. We also have Ms. Holly Bodie. She is the Vice President of Government Affairs at the American Kidney Fund, where she leads federal and state advocacy and public policy efforts. Ms. Bodie has an extensive career in DC, spending time on both Capitol Hill and within health and human services. And today, Ms. Bodie will address the policy opportunities to bring awareness to and address the unknown causes of kidney disease. She will also highlight the American Kidney Fund's efforts to address healthcare disparities within the minority kidney patient community.
Good afternoon, and thank you for the opportunity to speak with you today, and thank you to Vertex for allowing us to present today and talk a little bit about our unknown causes of kidney disease project. By way of introduction, the American Kidney Fund is celebrating its 50th anniversary this year, and that it's 50 years of fighting kidney disease on all fronts. For the 37 million individuals in the United States who are living with kidney disease and the millions more who are at risk of kidney disease, the American Kidney Fund is available for them at all points in their kidney journey. The American Kidney Fund targets our programs across the full spectrum of kidney disease, from prevention of kidney disease through the post-transplant period. Notably, the American Kidney Fund is the only kidney organization that provides life-saving treatment-related financial assistance. And the American Kidney Fund assists roughly 20% of those patients on dialysis financially. That assistance alone helps more than 100 dialysis patients each month be able to afford a kidney transplant. As you can see on the right-hand side of the slide, there's a diverse group of activities that the American Kidney Fund engages in, from financial assistance to raising awareness of kidney disease and advocacy, to the prevention activities, public education, as well as professional engagement. The AKF has a strategy specifically focused on addressing health disparities in kidney disease care. This is a four-part strategy that looks at prevention and awareness, home dialysis, transplantation and living donation, and increasing diversity in clinical trials. As we look at prevention and awareness, our goal is to expand prevention and early detection education, which builds on some of the things Dr. Egbuna just spoke about. In the home dialysis space, which is growing, we want to make sure that the individuals we serve are aware of the opportunities for home dialysis and able to access these therapies. Transplantation, which is currently the standard of care for end-stage kidney disease. Our goal is to help increase access to kidney transplantation and reduce the disparities that we see among access to living kidney donation. And then increasing diversity in clinical trials, understanding the importance of representation in clinical trials. As we start talking about the American Kidney Fund's Unknown Causes of Kidney Disease Summit, it's important to give you a little bit of background. When we think about the causes of kidney disease, again, building on what you just heard, you can see from this slide that we would estimate nationally that 5% of individuals who progress to end-stage kidney disease have a cause of kidney disease that's unknown. But this really understates the amount of unknown kidney disease that we see in the population. Specifically, if you look at the 26% of kidney disease that's currently attributed to high blood pressure, we see a common fallacy here. And that is that for almost everyone who develops advanced chronic kidney disease, they're going to develop hypertension as a consequence. And so it is not at all unusual that patients will present often late in the diagnosis of their kidney disease. They'll be found to have chronic kidney disease, they'll be found to have hypertension, and hypertension is attributed as the cause of their kidney disease rather than a consequence of the kidney disease. This is important to note because currently the gold standard for diagnosis is a kidney biopsy, and the majority of patients who progress to end-stage kidney disease have not had a biopsy diagnosis. And so it may be, in fact, that much of that 26% of kidney disease that's attributed to high blood pressure may, in fact, have a different cause. And this circles back, as Dr. Egbuna just talked about, that there may be underlying genetic causes that we're not aware of. Now, in the American Kidney Fund, because of our efforts to provide financial support to individuals, it's allowed us to have a large database of information on individuals. And we note that in the patients that we serve, a number of those folks report that they're unaware of what their cause of kidney disease may be. There's a number of causes for that that we'll discuss, but one of them, in fact, may be that we're not accessing all the tools available to give people an accurate and timely diagnosis. In recognizing the number of individuals that came to us reporting that they didn't have a clear diagnosis of their kidney disease, which has substantial implications for treatment and future therapies, we were able to put together a summit to look at the causes of kidney disease, our so-called Unknown Causes of Kidney Disease Summit. You can see on this slide that we were able to pull together thought leaders from across the spectrum of kidney disease treatment, from patient advocates to advocacy organizations, to research groups, to genetic counselors, all focused on how do we move the ball forward in getting patients a more accurate and timely diagnosis, and how do we really move forward focusing on these unknown causes of kidney disease that we believe have a genetic basis, things like APOL1. As we put together the Unknown Cause of Kidney Disease Summit, what came out of that summit was a roadmap to change. The roadmap helps to provide the nation with a consensus document for addressing the unknown causes of kidney disease. This roadmap document includes an in-depth discussion as brought forth at the summit of the existing barriers that exist to optimal diagnosis and treatment of individuals, and provides short, medium, and long-term steps for giving patients a better, more accurate picture of what caused their kidney disease. And this roadmap can be accessed at www.kidneyfund.org/UCKD. And at this point, I will turn the presentation over to one of my colleagues, Ms. Holly Bodie.
Thank you, Silas. Good afternoon, everybody. I'm Holly Bodie, the Vice President of Government Affairs at the American Kidney Fund. Thank you so much for having me speak today. Ogo and Silas have outlined the inequities in our healthcare system, particularly as it relates to kidney disease. Most recently, the pandemic has brought this into sharp focus. And while addressing health disparities has always been central to AKF's mission, it's become one of our priority public policy issues. Both here in Washington and in the states across the country, we're focused on the impact of kidney disease on communities of color, including addressing inequities in diagnosis through the UCKD project that Silas just talked about, promoting access to affordable healthcare coverage, and encouraging living organ donation. I'd like to review just a few of the efforts we are currently pursuing. So the unknown causes of kidney disease. Our overarching policy goals in this effort are to improve access to genetic testing for patients with kidney disease to increase the numbers of clear diagnoses. We also want to work to develop national standards related to the coverage, the insurance coverage of genetic testing through a consensus-driven process that will leverage best practices, including we will survey current Medicare and Medicaid coverage of genetic tests. Right now, there is no single policy, especially in Medicare, for covering genetic testing, and it can vary widely from state to state. We will develop an education campaign aimed at policymakers at the state and federal levels on why we need genetic testing for people with unknown causes of kidney disease. And finally, we'll identify additional opportunities at state and federal levels to promote policies that increase access to testing and genetic counseling services while also protecting patients' privacy. On the federal legislative front, we worked very closely this year with Congresswoman Lisa Blunt-Rochester from Delaware and Congressman Brad Wenstrup from Ohio to introduce the Care for All Kidneys Act in June. And we were extremely excited to have this opportunity to work with both offices. And we were also very excited that it was a bipartisan bill. So this bill would require a study to understand why communities of color and rural and underserved communities are adversely affected by kidney disease. As you heard Ogo and Silas say, for example, when you look at the Black population, about 1/3, only 13% of the American population is Black, but 1/3 of the people who have ESRD are Black. And so this legislation is aimed at looking at those communities and trying to figure out why this happens. It will create a national action plan to address kidney disease in these areas, and that includes educating providers and patients. This will place nephrologists in the hardest hit communities across the country by including them in the National Health Service Corps. And finally, we'll work to increase transplants in communities of color and in underserved and rural areas. We're also working on the Evaluating Disparities in Outcomes and Telehealth Act that was introduced recently by Congresswoman Robin Kelly. We're also involved on the federal front in a variety of regulatory issues and policies coming from the Biden administration. Back in July, we submitted a comment letter. It was an Office of Management and Budget request for information about practices for advancing equity for underserved communities. And among our comments, we focused on the importance of data in achieving equity. And that's something we've been working on for quite a while. Addressing beneficiary barriers in federal programs, addressing barriers to home dialysis and transplantation, ensuring patient access to charitable premium assistance. That's something we do at the American Kidney Fund We pay the premiums of about 74,000 people across the United States, the majority of whom are from communities of color. And also the importance of continued engagement with trusted community partners. Every year, there's a regulation from the Centers for Medicaid and Medicare Services about the ESRD, end-stage renal disease prospective payment system in Medicare, quality incentive program, and the ESRD Treatment Choices Treatment Choices model, which is to encourage more home dialysis. So we submitted comments in August on closing the health equity gap in CMS quality programs. And we commented on the following areas: future potential stratification of quality measure results, improving demographic data collection, again, the importance of good data, and potential creation of an ESRD facility equity score to synthesize results across multiple social factors. And we are very excited. This week we had our congressional briefing. We do one every year. Of course, the past two have been virtual. So if you can't join us live, it will be on our AKF YouTube channel. And this year we're focusing on transplants in communities of color. And we will have a lot of very interesting speakers, including Congresswoman Lisa Blunt-Rochester, who's been invited, Dr. Keith Melanson, who is the head of transplantation at George Washington University, Frances Ash Goins, who former deputy director of the Office on Women's Health at HHS. She was a caregiver to her daughter who had end-stage renal disease, and she's also a member of the board of directors at AKF. And LaVarn Burton, our president and CEO, and we also have patient advocates that will be speaking at the briefing as well. So a question, I know that when people talk about legislation and public policy, this is really something a citizen's job is, how can you help? And couple of the things that we can suggest to reach out to your member of Congress and or United States Senator and ask him or her to support the Care for All Kidneys Act, which I just talked about. That's only a House bill right now, but we're working on getting one in the Senate. Increase funding for the National Institute of Diabetes and Digestive and Kidney Diseases so they can do more research on causes and possible new treatments for kidney disease. Kidney disease funding is vastly, vastly, vastly under many other diseases. And in the past 30 or 40 years, there hasn't been a lot of forward movement. And part of the reason of that is not enough funding. And so this is something that's very important to everybody in the kidney community. And finally, to support the Chronic Kidney Disease Improvement and Research and Treatment Act, this would increase awareness, improve understanding, and promote access to treatment for kidney disease. And with that, I just want to say thank you so much to the Congressional Black Caucus Foundation and to Vertex for inviting us to speak. Thank you.
So, Dr. Norman, could you talk a little bit about the impetus for the Unknown Causes of Kidney Disease project and why this project is so important?
Absolutely. Thank you. So, as I mentioned in my opening comments, the American Kidney Fund provides a substantial amount of financial assistance to individuals across the spectrum, but particularly the dialysis population. And as a result of the financial assistance we provide and the applications that go into that, we have a lot of information about the demographics, the income, of course, geography, and importantly, the primary diagnosis that our individuals that we serve report. And in reviewing our information from 2019, what we noted is that as opposed to that 5% of unknown causes of kidney disease that's generally reported, our individuals that we serve, 14% of those individuals reported that they were unaware of their cause of kidney disease. We looked at this and recognizing the population we serve, which is a disproportionately individuals of color, particularly African Americans, individuals who tend to be lower on the spectrum of socioeconomic access. We thought we really need to look at this because this is the population we serve. And by definition, if people are unaware of their causes of kidney disease, by definition, it's not going to get treated. And then certainly from the transplant standpoint, there's some potential for recurrence of kidney transplant afterward. And so we thought, how can we best investigate this to figure out how to better serve individuals? And so what came out of that was really getting together this summit to look at unknown causes of kidney disease, to really try to pin down how much kidney disease is really unknown, what are the reasons for that, what are the barriers to accurate diagnosis, how much of that may have a genetic basis. And in doing that, we tried to bring together thought leaders from across the spectrum, particularly in the advocacy and the genetic testing space, to really come together and really start a roadmap to get a consensus together so we can understand how to best serve people.
Thank you. Thanks. I have a follow-up question, and I direct this to Ms. Bodie. In December 2020, the American Kidney Fund convened more than 100 stakeholders, as Dr. Norman just mentioned, to discuss research on this project and identify any barriers to progress and to develop a plan moving forward. Could you talk a bit about the process and the type of stakeholders that you convened?
Yes. So we included people from all across the kidney space. So we had patients, clinicians, pharmaceutical companies. I think there were 40 organizations that participated. So we had breakout groups and everybody reported back at the end. And I think it was an event that people really felt their voices were able to be heard from across the spectrum.
Okay, great. So the report referenced some of the barriers, particularly patients receiving a late diagnosis of kidney disease, and that a confirmatory diagnosis by a nephrologist won't likely change the course of treatment. Dr. Norman, could you talk a little bit more about this?
Absolutely. So one of the things we recognize is that a lot of the individuals we serve a so-called crash onto dialysis. That is, that they had little or no awareness of their kidney disease until they often presented to the emergency room close to or needing dialysis services. One of the things we saw as a common thought or expression out there among the physician population really was the idea that, well, folks are presenting near or at end-stage kidney disease. There's really no reason to know what underlying disease they have. It's not going to change the treatment we give. But in fact, we know that many diseases, particularly if we're looking at genetic diseases, although you may not be able to change the trajectory of that particular individual, it may be very important for their children, for their siblings in terms of earlier diagnosis, awareness, and treatment options. And it may be very important as we move folks ideally to transplantation as their cause of kidney replacement therapy, that we're aware of what their real disease is, because that may have substantial implications on how well their transplant functions, how long it lasts, and what medications they may need. So I think one of the key takeaways perhaps is that it's never too late to get an accurate diagnosis of kidney disease.
Yeah, and what are some of the recommended interventions to address, this, I would say, astonishing number of people that don't know the cause of their kidney disease?
Yes, thank you. So I think we can work from, we need awareness, access, and then accurate diagnosis. And so there's substantial room to directly educate patients about kidney disease in general, about the importance of early diagnosis. There's a substantial room for us to educate both primary care physicians as well as nephrologists, again, about the importance of early diagnosis of kidney disease, but also as more and more testing that didn't exist, I think, when you and I trained, these really exciting new genetic tests, that we educate the physician population about the availability of these tests, that there really are things that we might be able to know that we didn't before. And then with that education, then really formally moving people to getting the testing. And then in getting people tested, again, I think there are potential hurdles, potential barriers for us to overcome in terms of making sure that everyone who should be tested has access to those tests, that the hospitals and so forth, they're getting treatment, are aware of these tests, familiar with them, so that, again, we make sure, particularly for often disadvantaged groups, that they have, that there's equity in our more accurate diagnoses of kidney disease.
Thank you. Ms. Bodie, this question is for you. Can you talk a bit about some of the continued challenges faced by people living with chronic kidney disease in general?
So yes, as Silas mentioned, often people don't even know they have kidney disease in the first place. And so that is a challenge, that people may be closing in on stage 4 or 5, meaning kidney failure, and not even know that they have it. Ongoing challenges are making sure that people have affordable and high quality health insurance coverage. That's key in getting a diagnosis, and once it's diagnosed, how is it treated? There are issues, of course, with social determinants of health. Before someone even has kidney disease, there are certain factors that we know lead to some of the risk factors of people getting kidney disease. Living in a community without good schools or access to good food, communities that may be more difficult to get a lot of exercise and outdoor activities in, social determinants, or even not having great access to healthcare when you're a child, has an impact on you in your later life and can lead you to be at higher risk of having kidney disease. So those are just some of the factors that I think there are multiple ones, and those are just a handful of those.
All right, thank you. The American Kidney Fund has shown a very deep commitment to addressing, the continued disparities that we see amongst racial and ethnic minorities. How will these efforts help address some of these disparities? I know, Ms. Bodie, you just mentioned this, so maybe you could also shed some light on this as well.
Sure. So it's, as we mentioned in the slides, our health equity work in this year and coming years, and this is this is not just multiple years, this is a project that will be in perpetuity, of course. We intend to focus on 4 areas in kidney disease, and that's prevention and education, more minority participation in clinical trials, and making sure that, and then home dialysis and transplantation are 2 things that, again, we know that communities of color have lower rates of transplantation. They have lower rates of living organ donation recipients. And we also know that the communities of color that have access to home dialysis is also much lower than it is in other communities. So we hope to raise awareness in education, like I said, in prevention. In clinical trials, we plan to expand on the solid resources we already have from patients for communities of color. We hope that in addressing some of the myths and misconceptions around clinical trials, we can build confidence in patients. And a large part of ensuring that people have access to clinical trials is to include or ensure just practical access. If you don't live near a city where there are clinical trials going on, then you by default have decreased access to those trials. So we want to do what we can to help people have better access to clinical trials. In home dialysis, we'll be launching education efforts about home dialysis. I think the pandemic has certainly increased interest in getting care at home. We know that people who are on dialysis have a high risk, and had a high risk of COVID-19. So being able to get dialysis at home is really an important option. It's not an option for every patient, but we want to make sure that patients who want to do it can. And we'll be providing, like I said, educational and outreach efforts on that.
Okay.
And
sorry, did you want to say something else?
no.
Oh, okay. All right. Well, I'm quite sure, the American Kidney Fund and many others that you convened together, have ideas on how to, implement the roadmap that, the American Kidney Fund, had initiated. What role would the various implementation groups that you had brought together play in the next phase of progress? And can you specifically talk about the public policy implementation group and its efforts?
Yes, course. So we had our first meeting in August, and we brought several stakeholders we had patients, clinicians, pharmaceutical companies, a genetic counselor. So we brought people from all across the spectrum on the unknown cause of kidney disease. And among the options that we discussed was joining existing and ongoing efforts on biomarker legislation when appropriate. This is primarily at the state level, working closely with organizations such as the American Cancer Society. There's federal legislation pending right now in the House and Senate on requiring Medicare to directly reimburse genetic counselors. Right now, counselors can be reimbursed by Medicare, but not directly. So this, it's HR 2144 and S 1460. So this would allow Medicare to pay genetic counselors directly. As I mentioned in my slides, there's a lot we don't know about what is covered and how insurance companies cover genetic testing. And since insurance companies often follow the lead of Medicare, we will do a study looking at Medicare and Medicaid and see what their current coverage policies are. We also will be working, this is a very long-term effort, but we want to work with the Centers for Disease Control to help them change their guidelines away from just recommending kidney screening to only kidney screening high-risk patients to screen all patients who come in. I think catching this kidney disease early is essential for patients to make sure it doesn't progress. And so again, that is a very long-term strategy, but one that we're very excited to pursue.
Okay, great. Thank you. Dr. Norman, this question is for you. You know, cultural competency and cultural sensitivity play such an important part in the provider-patient relationship. Can you share your thoughts on the importance of cultural competency?
Absolutely. I think it's critical. As we have the great opportunity to take care of patients, we take care of folks often for years, and if we're fortunate, sometimes for decades. And that means that there's going to be a relationship there. And like any relationship, it needs to be built on solid foundations. We know from a number of studies that patients often prefer having providers that they feel like they can have a good relationship with. And often that's folks who share the same background or culture or language, geography. And so I think a culturally competent approach is necessary to get optimal outcomes for individuals. Trust in the medical system, but particularly trust in your provider, is essential to have those optimal outcomes. The care of kidney disease, which as Holly mentioned, is often asymptomatic. And then folks come to see us and we're talking to them about needing blood pressure medications and needing to change lifestyle and needing to change what they're eating, so on and so forth. That requires a lot of trust in your provider to make those changes and know that that person's working towards your benefit. And so certainly one of the things we have to think about is we know that the current physician and other care population doesn't reflect the disease population, doesn't reflect the chronic kidney disease population. And so I think there's certainly a lot of opportunity there to make the care community better reflect the people we care for as a mechanism, one mechanism to helping people get better outcomes.
Okay, and just a follow-on question, how do we continue to educate the patient community, particularly those at greater risk, about kidney disease and testing? I know Ms. Bodie had spoken to, expanding beyond those that are just at high risk, but, can you share your thoughts? And Holly, feel free to share your thoughts as well.
Sure. So one thing I think we have to just think about meeting people where they are and providing education in as many different media as people are receptive to. And so that may be webinars, that may be in-person meetings, that may be going to churches and other religious organizations, that may be partnering with other like-minded organizations, sometimes fraternities and sororities that have medical missions. And then recognizing that the economics of the patients that we take care of, realizing that not everybody may have, a laptop or stable internet access. And so, there may be room for written materials and to bring things directly into communities. Following up on the cultural competency, making sure that we have things that are culturally sensitive, that are translated linguistically so that we're matching the language of the people we're taking care of. So I think there's a lot of opportunities, but I think that with the main focus on doing what's best for the patients, and that is keeping the focus on meeting the patients where they are, to expand our opportunities to continue to educate folks as early as possible.
Okay. And Holly, do you have any thoughts you would like to share on that particular topic of educating the community?
I think Silas covered it very well. Thank you.
Okay, great. So last but not least, where could those that are interested or intrigued or concerned about getting more information about, genetic testing, be it for APOL1-mediated kidney disease or the unknown causes of kidney disease roadmap? Ms. Bodie, Dr. Norman, do you have direction or guidance for where people may go to get more information?
Holly, I would suggest going to the American Kidney Fund website. There's a tremendous amount of information on the website, in prevention information, education information, information about the roadmap. And I think that's a great starting place, a jumping off point for individuals, whether they're in the medical field or lay individuals, to get a foothold and really get some good information to get started.
Yes, our website is very, very patient focused. And so we really do encourage people to go to the website and to learn all about kidney disease.
Excellent. So in closing, I'd really just like to thank the Congressional Black Caucus Foundation for its leadership and unwavering commitment to convening this important legislative conference. This annual legislative conference continues to serve as an important platform in addressing issues that uplift, empower, and mobilize Black communities. The session today on kidney disease was an important opportunity to highlight the unmet needs of the disease and some of the continued challenges of the kidney community, particularly the disproportionate burden of kidney disease in communities of color. This was also an important forum to underscore some of the innovative and exciting opportunities to improve the lives of those living with kidney disease, and for those who will receive a diagnosis of kidney disease in the future. I want to thank you especially, Dr. Norman and Ms. Bodie, for your participation in the panel today. We look forward to our continued partnership with the American Kidney Fund and working on the implementation of the unknown causes of kidney disease roadmap. So to everyone, I would say thank you for listening.